What we would like to show you today is that you can still, in simple format, applying the rules and the methodology of the Omnichannel, create something that is useful for you and for your company.
Companies or organizations that are truly implementing omnichannel strategies can see an expanded market reach, higher conversion rates, increased customer loyalty, and improved operational efficiency, all in all delivering an enhanced competitive positioning.
The omnichannel approach seems to be augmenting the power of the commercial force. The customer may not want to buy, not because there is not the need or the desire to buy, but because the conditions are not ready. We can constantly keep the relationship high in order that when the customer is ready to buy, they're ready to buy from us. We will present two cases here. One is a standard B2B situation in which a contract manufacturer is selling to medical device professionals. And then instead, the second case will show a situation where a medical device company is selling to healthcare professionals.
Thinking of LinkedIn as a starting point, the first thing we did was to concentrate efforts on expanding the network of our key person of influence. What we managed to do in a very brief period was to increase the network by 1,500 connections. We started 25 meaningful conversations all throughout those channels. We activated 880 targets, and we managed to create 12 high-quality leads.
You have clearly explained how all the other channels were rebounding the same information and consistently working alongside to ensure that the customer had the possibility to see that message again and again.
Okay, let's move to the other one.
Here we are using a double channel approach. And one interesting thing here is about the content boost or the display ads.
I think with the two cases, we see how similar strategies have actually had different approaches. How did the transition from those digital engagements into real conversation?
We were simply either moving to the email or trying to get the telephone number and then connecting, let's say, the sales manager with the potential client.
These two cases offer the opportunity certainly to see many of those principles in action, from the channel selection to the target selection to the message personalization. It was a very comprehensive opportunity to experience how with simple ingredients you can immediately start without thinking that applying omnichannel necessarily means rethinking from A to Z.
All right, welcome to our LinkedIn Live. Welcome again. Good afternoon, good morning, wherever you are. The CommuniD LinkedIn Live is a monthly podcast on the emerging trends in the medical device business with a specific focus on the digital tools. The live has the objective to support as much as possible the professionals of this industry in their education, in their growth, in learning more and more digital tools. The focus of today is the omnichannel sales approach. This second LinkedIn Live on the omnichannel approach comes from a request of one of the viewers that after the first live that we had 2 months ago, asked me, all right, yes, you told us all the theory about the omnichannel approach, but now we would like to understand a little bit more and a little bit better if these approach has been used, it's been explored in real life. So what we will do today, we will tell you about real life stories, at least the experience that we have. But before doing this, I would like to introduce the two speakers that will be with me today. The first one is Annalisa Ernica. Please, Annalisa.
Hi, everyone. Annalisa is my name. I think most of you may know me. I am the digital strategy lead at CommuniD, and I am the person that was responsible for the deployment of the 2 case studies that we are going to see in this live, and I'm very happy to be back on the podcast.
The second speaker is Marco Baiguini, that was with us in December. Marco.
Hi, everyone, and nice to see you, Elvio and Annalisa. Thank you very much for the invitation. It's a pleasure to be back on the podcast. A brief introduction. I have, as I explained in our first podcast, I come from almost 20 years of experience in the MedTech, where I actually focused on commercial roles. And today I am really passionate about helping organizations improve their commercial operations. So omnichannel is definitely an area where I am all in and very much interested to discuss how this is applied in real life settings and how can we exploit it to enhance sales practices in our industry.
Perfect. Thanks, Marco. Before we start and we could kick off with the presentations, I would like to remind every one of you that you can anytime ask your questions in the chat box. If you want to start to familiarize with the chat box and start to write us from where you're logging in, it would be great. Just a simple hello, I'm calling, or I'm from Turkey, I'm from Germany, I'm from UK would be excellent. We want to start this conversation with a recap. Marco, do you think you can summarize your 1 hour presentation in 5 minutes?
I will do my best. I think what it's important today, before we obviously deep dive into practical cases and have a conversation of how, let's say, omnichannel works in practice, or at least parts of it, I would like to maybe touch upon a few ideas, and I'd like to start from let's say starting from the basics, starting from what it is commercial operation, what it is sales, and I'd like to start from what I call the commercial excellence in formula. If we can show the first slide, please. And before speaking about omnichannel, I would like to really make sure that we all agree on the fundamentals. And I'd like to start by the idea that winning in sales isn't about just working harder, but it's about working smarter. And that's where I believe omnichannel can really help us in doing so more efficiently and also more effectively. The commercial excellence formula that I like to suggest is that activity times target group times message plus engagement are excellent to deliver sales. Where activity is what we do, is all the initiative that we take, all the contacts that we make with our customer. The individual or target group is really the person that we wanna reach and that the activity is made for. The message is the content, is the value that we bring to that particular stakeholder. And the engagement is the experience, is how we make it possible to interact with that person, and we make possible for that person to interact with our organization. And I like to think about it as a formula, because I truly believe that all these elements are reinforcing each other, are complementing each other. And if any of this is missing or not done in the right way, obviously the result won't come. And I would like to start from here, because this is fundamentally at the core of sales, and we will see that omnichannel is a tool to enhancing this. For example, if we look at the activity, one of the key questions we can ask ourselves is, are we making enough quality touch points, and how can we do more? And we will see how omnichannel will help us in this case. If we talk about individuals, we will discuss about, are we talking to the right person, but are we really making that interaction personalized? And we will see how omnichannel enables that level of personalization beyond what it's commonly done in sales. Similarly, when we think about the message, are we communicating a clear value? And how can we use different tools, different means, different channels to amplify this message and deliver it consistently, even when we are not there directly? And finally, the engagement is really about making it easy and enjoyable to work with us, with a company. And we will see that our omnichannel and all the different channels will allow that level of flexibility, and hopefully allow the customer to interact in the way they want, when they want, through the means that it's more comfortable for them in that particular moment. So grounding this, the entire omnichannel journey into, let's say, fundamental sales practices, for me is a very important starting point. From there, if we move to the next, we can build the concept of omnichannel as integrating multiple channels, focusing on the customer, and making sure that all these channels are speaking, so creating those activities, speaking the same message, and putting the customer at the center. So that the customer fundamentally enjoys or has that access that is what he was looking for in the way that it's more suited for the way he wants to consume or he wants to reach that information. Another important element that I think it's very important or central in terms of omnichannel is the element of data. And here I would like to spend a little bit more of time, because omnichannel has a strong element in data collection, in understanding how customers are responding to those signals or those interactions that we are giving. And this data becomes for us or for the sales team signals that they can interpret, that they can understand, and that they can use to determine what is the best next action that they can do. So putting this element into omnichannel is another one that we discussed extensively in our first slide that I want to remind here. Some of the clear advantages of applying such an approach is obviously that this will enable scalability and automation. For example, adopting digitalization augments the ability of any commercial team to reach a broader audience and do it many times in an automated fashion, which obviously has a big operational advantage. Allows personalization and customer satisfaction. I think I have already covered this extensively when I insisted on the importance of accessing the information the way the customer wants, but also, again, on the importance of the data in order to make sure that we understand that feedback of the customer and eventually deliver even a more personalized as we learn more about it. And finally, a clear advantage of smarter and more efficient sales processes as fundamentally augmenting, again, the sales team and making sure that you can interact in a very cost-efficient manner, and therefore being more present to your customer than you could actually be in a more traditional way. As a final message, I believe that companies or organizations that are truly implementing omnichannel strategies can see obviously an expanded market reach, higher conversion rates, hopefully increased customer loyalty, and as I just said, improved operational efficiency, all in all delivering an enhanced competitive positioning so that the customer will be able to perceive not only the service or the product that is provided, but the entire way of accessing that service. If I'm allowed a very final consideration.
No, you're not allowed. Of course, yeah.
Then I would say let's jump to a very final slide that I would like to use as a summary. We are most of the time thinking of the lead generation, the awareness generation, so the initial phases of interacting with the customer. But as we have, let's say, extensively discussed, I would always encourage everyone to think omnichannel along the entire customer journeys. So while awareness and learning, so the initial phase of an engagement, are perhaps the most obvious one, where applying the concept that we've just discussed came naturally, it's important to think about it along the entire customer journey. There are plenty of opportunities where digitalization can be an extended part of your commercial team and allow you to collect those data, to deliver those messages, and eventually that experience that we've discussed about. So all in all, hopefully I have reminded everyone about the principle, and we can discuss more in details in concrete cases now.
Excellent, Marco. You've been able to summarize in 5 minutes or in 7 minutes, 1 hour of presentation is excellent. And I would like to stress 3 points of what you discussed, because it's something that is really, that I think is the real juice of what you said. The first one is the word augmentation. So the omnichannel approach seems to be augmenting the power of the commercial force, the sales rep, but overall of the commercial force. The second is the data collection. Data collection meaning the ability of, or the attempt to rationalize something that we have always believed being emotional, being creative, being artistic. We think of the sales process as an artistic process in which there is a lot of gut feeling and the right moment. And it's probably true, but what we're trying to do with the data is give value to those signals, give value to the interactions. And the third one is the importance of understanding the full customer journey. The omnichannel approach is not only in the lead generation, but can be applied in every stage of the sales process. Is that fair?
Absolutely.
Okay, that said, I would say, let's see in the medical device business, which are the channels of the omni-channel. So if we can go to the other slide, we don't want to kill you with a lot of PowerPoint slides, but few of them will help us in our conversation. So the clear first channel is the direct engagement. So it's what the salesperson is doing, is the in-person meeting, the customer support, SMS, messaging, all the conversations that we have with our clients. The second big channel, and it's probably the one that is slightly different to the standard way, or maybe used in a different way, is the digital. That is including the website, with all the possibilities of the website, social media, mainly LinkedIn and YouTube, then email marketing, mobile apps. Mobile apps are becoming more and more important and are connecting, like in the logistic area, to make the client aware of the consignment kits or the inventory available. Then all the activities that customers may do in the search area, and so search and SEO. And then all the virtual and digital meetings like webinars, virtual events, something like a LinkedIn Live. Then we have all the offline events, standard events that we are all doing, trade shows, congresses, and print media, brochures, catalogs, all the tools that we are giving, that we are handing out to our clients. Then another very important channel is the third party. In our business, in the medical device business, I have completely eliminated Amazon, eBay, that are not relevant, but for sure we may have partner networks or independent agents that are playing with us in the management and recruitment of the customers. And then the big chunk, the big solid channel of the data and integration. And here in the data and integration, we have three types of very important source of information. The first one is the CRM and marketing automation. And we understand what a CRM is. So this is pretty a simple tool, not simple, but a standard tool in the sales process. Then we start to have planning tools and artificial intelligence predictive analytics. A lot of clients are using pre-operative planning or designing tools. These are all elements that are not only supporting the HCP in the definition of his or her task, but also can refer about which are, for instance, the surgeon's preferences or the HCP preferences. So they are telling something about the behavior of our clients. And then we have the new big word of the IoT, the Internet of Things, wearables. All the elements that the patients may use in order to track their activities or their behavior or the drug intake. All these elements are new set of data that we can use as salespeople, that we can use in order to build our story and create our pitch. The beauty of the omnichannel, if you want, or one of the bases of the omnichannel, is that if in the sales process, all these elements, the website, the meetings, social media, kind of remain detached, with the omnichannel approach, we are syncing all these elements to create a set of data that will allow the commercial force to understand better what is happening and to learn in order to be more efficient. If we can change the slides, this is my last slide of preamble, and it's about a book that I recently read that is called The Little Book of Selling of Jeffrey Gitomer. This book is saying one thing that turned to be very interesting for me. Customers buy when they want to buy and not when we are ready to sell. And to me, this opened a world, if you want, because taught me to understand a few things. The first one is that the customer need to be aware of my solution and need to understand my solution. But also the conditions need to be right for him or her in order to buy. And the conditions might not be ready. So the customer may not want to buy, not because there is not the need or the desire to buy, but because the conditions are not ready. To stress these elements, we were discussing with some salespeople, and we went to the point that we said, okay, so sales is not convincing. Sales is just making sure that you are preparing the dish, that you are creating all the appropriate prerequisites to allow the customer to buy. But then it's the customer decision when they want to buy. And by the way, I made a poll on LinkedIn, and 88% of the people said, yes, this is exactly what is sales. Sales is not convincing, sales is preparing, and then the customer will buy. But we would like to avoid to let you think that this implies a passive approach or a passive role of the salespeople. Absolutely not, because while the customer is getting ready to buy, what we can do is we can feed information, we can nurture, we can constantly keep the relationship high in order that when the customer is ready to buy, they're ready to buy from us. And this is a little bit what we were discussing with Marco before. In this process, we need to read the signals. And the signals are something that the customer is giving to us in different ways. And I don't know, in a digital way, we could rank the value of these signals. I don't know, a website visit could be ranked as 1. If they're checking our videos on YouTube, could be a rank 3. If they are downloading the material, could be a rank 5. If they are accepting our visit, could be a rank 7, and so on and so forth. But what we need to do throughout this journey is to try to attract signals that are explaining where the customer is in this process of getting ready to buy, and according to those signals, change our behavior. And this is exactly what we did in our 2 cases. Now, I think the preamble is finished. We are going into the cases, and we will present 2 cases here. One is a standard B2B situation in which a contract manufacturer is selling to medical device professionals. And then instead, the second case will show a situation where a medical device company, is selling to healthcare professionals. As you will see, there will be several differences that we will highlight. Another element in preparation to Annalisa's presentation is that we are presenting here 2 very basic cases. And for basic cases, I'm meaning that we are using limited channels, we are using limited digital tools or data trackers. In both of these cases, the CRM was a simple Excel spreadsheet. And also the third element of the fact that these are basic cases is that they did not need huge infrastructure and huge cost. So it's something that has been organized in a couple of months, deployed, and has generated results in 3-4 months. Clearly, we don't want to simplify the concept of the omnichannel. The omnichannel can be incredibly more complex. But what we would like to show you today is that you can still, applying the rules and the methodology of the omnichannel, you can still, in simple formats, create something that is useful for you and for your company. Annalisa, I think we said everything and we should be ready to go.
Right. Thank you, Elvio and Marco, for the great introduction with all the comprehensive details that we needed to recap the concepts and have all the elements in place to analyze this case study. As Elvio mentioned, we have two cases. One is completely B2B. So we are talking about a global leader medical device content manufacturer, and they came to us with the need of enhancing their sales opportunities for the sterile packaging solutions. And the first thing we did to apply the omnichannel approach in a simple way that could provide tangible results in the fastest possible time frame was to define a key person of influence that we could use to expand our network within this specific target market. And just for your benefit, a key person of influence is that very person that you have in your company or in your department that has the knowledge of the product that you are trying to sell or the solution that you are trying to offer. And this person has to be the potential to expand the network. So we needed those two elements to find a solid key person of influence. And once we have found this key person of influence, we could start thinking of a journey. So thinking of LinkedIn as a starting point, the first thing we did was to concentrate efforts on expanding the network of our key person of influence. So we created lead lists to find the possible targets, and we started these inviting campaigns to invite them to connect with our key person of influence and become part of their contacts. After we had a solid network, of course, the network expansion, as everybody on LinkedIn knows, is an ongoing effort. So, of course, you are constantly expanding your network. But the first thing we need to do when we think of omnichannel is to take the time to expand network. After this is done, we started with multiple activities that were all integrated, as Elva mentioned, by this Excel spreadsheet that we had to be able to provide to have a follow-up on all activities. So it was newsfeed activity through the personal profile. It was target outreach through LinkedIn messaging. So we were sending direct messages to the targets. We had an email communication as well, done through the company's email of our key person of influence. And of course, our person was also going to events, meeting people there, and all those activities, they were integrated. And we were harvesting leads from each one of those. So from the newsfeed activities, we are collecting signals such as likes, comments. In the target outreach was very obvious because people were responding positively to the message, interested in learning more. Same for email communication and same for in-person events. And the last step here was to collect all those requests and start tracking our conversions. And what we managed to do in a very brief period, so starting in September 24 up to last month, February 25, was to increase the connections, the network by 1,500 connections. We started 25 meaningful conversations all throughout those channels. We activated 880 targets, and we managed to create 12 high-quality leads that carried on the conversation then with our client. Here you can see this better. And what could we learn from this case study? What could we learn on the way as we were carrying on the activities for this account? Was that personal profiles, they drive an immense amount of engagement, especially in comparison to corporate pages. It's much harder for a person to interact on a corporate page as it is from a personal profile. Second element that we learned was that content creation, so posts and outreach, they work together. So they work in sync together because while you're creating your posts, you are passively educating your audience. So when you start the outreach, which means the messaging, they will be much more ready to receive your message as if you are not doing any sort of education through posts. So third lesson that you learn here is that a good key person of influence makes all the difference. So this is not something that the marketing department can do by themselves, or as CommuniD, as an agency, can do by themselves. We really need to have a collaborative person on the other hand that is following through the strategy and being active. And the fourth insight that we harvested from this strategy was that this concept is easily replicable, especially if you think of a context of a large company, a medical device manufacturer with different business units. So you can start by applying this concept on a smaller business unit or a smaller department. And once you have everything, all the process metabolized, and you understand how this works, you can easily replicate this concept to other business units.
Can I, sorry,
Sure.
yeah, can I just pause here for a second and see if it's clear, the process is clear? So basically what we were doing was that we were leveraging LinkedIn to contact potential buyer of the product. The product was relatively simple to be explained, and through the direct messaging and the engagement, we have generated the interest and the connection that then has allowed the possibility of creating conversations, and those conversations turn into lead generation. Very, very, very simple process that though generated an interesting increase in the number of leads. I just want to pause for a second and ask the audience, is the process clear? Is there any question? I'm watching on the two screens. I don't see any comment. I think, okay, let's move on, Melissa.
Let's now have a look at, in the context of the Omnichannel, what the future could look like for this client. Because as I said, we started low and slow with something simple, easy to digest, that would provide the best results. But if you want to go a bit more sophisticated, we can start, and with this client we have already started, is to start concentrating resources on their website with what we call gated content. Again, for your interest, gated content is basically something that you provide to your target audience in a way that they have to put their email or add information about themselves in order to download the content. So it could be a brochure, it can be a leaflet, it can be a set of articles, something that is very interesting for your target audience, that will make them take the next step of putting their email to download the content. So you can add some gated content to the website. So they go there, they put their email. The second thing that we can do is through Google search and paid traffic, we start to drive traffic to the page, because if we start concentrating traffic on their website, we can also start collecting information through cookies. And then something very sophisticated, very interesting that we can do at the very end is to start triggering some multi-channel retargeting ads, because once you have driven all these people to the web page, the website, for them to download the content or read something interesting, the cookie that is on the website, it will collect the information. Once they collect the information of this person, it doesn't matter if they go back on LinkedIn or they go on Facebook or they go on their newspaper website, they will start seeing ads from this client, or they will start seeing information everywhere about the solution or the product. And just attaching to what Elvio said, all this mechanism has one objective, is to create the right environment for the customer to buy your product, to buy your solution, not by forcing them into do so, but being here and there, reminding this person that your solution exists and that your service is right there for them to purchase, your solution is ready for them. Do you want to add any comments, Marco, Elvio, before we go into the next case?
Yeah, the only comment that I can add is that with the Google search, we try to, again, in the concept of the customer is ready when it's ready. Yeah, there might be some time. With the Google search, you are funneling customers that are ready to buy in that moment. But in the medical device business, this is not always the case. We are doing complex sales that are involving multiple functions. And so generally it's not a simple, what is called a simple sales. And therefore the retargeting will allow a person that has started to see you as a solution, it will help to constantly remind about the solution and to constantly make sure that when the time is right, you are on their radar screen as potentially the most interesting and valuable option.
From my hand, well, first of all, thanks, Annalisa, for the deep dive. I think more than a question, a comment at this point is really about this is a good case to see how you have chosen LinkedIn as the central piece where the campaign started, or where the campaign core, but then you have clearly explained how all the other channels were fundamentally rebounding the same information and consistently working alongside that key message that was driving, to ensure that the customer had the possibility to see that message again and again. And you also commented already very nicely how you were collecting those feedbacks, those interaction, making sense of these interaction to trigger additional activities that were all engineered from the beginning. So you knew exactly what had to happen in case of a certain behavior. And that's exactly what in the initial words I was mentioning, by having different channels all focused on the same objective and orchestrated in a way that all the activities are intentional. Curious to hear more about how it worked with the second case as well.
Yeah, we have a question from Rhiannon, and is asking, what about getting third parties like partners, sister companies, media, to create follow links to the site? I prefer that to paying to generate traffic. Annalisa, I don't know if you want to take it, or should I?
No, I can take it. Yeah, so this is a very interesting question, because this can be seen as an alternative to paid traffic through Google search or display ads. And it's interesting because you are, how can I say, you are already doing a first level of screening on your leads. However, in our sector, in the medical device sector, it's not super easy to have this because we have limited channels. So you can use the sister companies and part websites to do those links. But the Google search will provide you, as Elva mentioned, with the people that have already this very specific need, and give you excellent results. One thing that I always recommend to our clients and everything we do is to do an A/B testing. Sometimes you can put some of your budget on the search ads and put a little bit of budget in the follow links, and then you can see which one that performs best, and then you can either carry on with both for a certain period of time, or then you can choose the one that works best for your strategy.
By the way, I think this question opened to another element, that at this stage in the medical device business, Google ads are not incredibly expensive. So they are, I would say, they are relatively cheap versus what we generally spend in a congress. But I would say significantly cheaper. So it makes sense to test it and to go outside. So when you're using third parties, you're still working within your network. Google Ads allow you to go completely outside with a cost that is really worth investment. I would say in the advertising world, until you stay away from LinkedIn, sorry for the hosting, but until you stay away from LinkedIn, you're relatively safe.
Yeah, I just wanted to add something into the conversation that is extremely important to consider when you are using the follow links, is that the efficiency of your strategy is sometimes very attached to how big is the authority of the website that you are using to give you the link for your website. And this is more in the SEO context. If you are putting links that lead to your website in a page that is not that doesn't have a high authority, or that have SEO issues, that can be detrimental to your website. And this is very difficult to catch because most of the times the other websites, they will not tell that they are not SEO optimized or that they have been received the warnings and these kind of issues. So again, from this perspective, the safest bet is the Google Ads, the search ads.
Okay, let's move to the other one, the one that is involving a medical device business going to HCP.
This is a case study that have the two parties are a mid-sized Italian orthopedic manufacturer that is trying to communicate to healthcare providers and also to key decision makers within clinics and hospitals. So here, what we are trying to do is to raise product awareness of a very innovative regenerative medicine product that we are introducing to the market. And our target here, as mentioned, are orthopedic surgeons and the decision makers of those clinics and hospitals. And our target here is to find these people, engage them, and our ultimate goal is to bring them into a demo of the product so the client can carry on with the selling process. And here, the step-by-step that we did, again, very simple. For this client was first things first. Here we had to optimize their web page because all the information that this surgeon needed to learn more about the product was on the web page. So we did SEO optimization. We optimized everything on the page. Here we are using a double channel approach within LinkedIn. So we were using the corporate page for product awareness and education, and then we were using the personal profile for outreach. Also, for this reason, we managed to do some sponsored traffic via LinkedIn because you can only do pay ads on LinkedIn using a corporate page. And then together with the sponsored traffic, which was boosting posts, creating display ads on LinkedIn, we also did, of course, the direct outreach. So we messaged the surgeons directly. And here I want to make a caveat because this was, I think, the biggest insight of this client was related to the direct messaging. And once we finished all this trajectory, we were tracking the conversion and using the conversions to optimize our process. And here, the very interesting insight we got was the messaging, because the first test we did for the messaging was to try to offer the product to the surgeon, or quote unquote, try to sell the product. And we saw that it didn't work very well. We were not having amazing results. We didn't have the outcome that we were expecting to have. So we had to take time and think through it and understand deeply the behavior of the surgeon. And then on a second trial, we started offering, in partnership, of course, with the client. We discussed with the client a solution, and we started offering a clinical study. So the opportunity to the surgeon to learn that product through a study. And then we finally managed to get excellent results. And as we can see here, from our targeted LinkedIn ads, we've got over 35,000 impressions, so significant visibility. We managed to contact more than 350 surgeons. We established 20 new contacts within the industry. We've got 13 sales qualified leads. Since then, there we had the paid ads. We've got a cost per lead of around 150 euros. And by now, we know that the client closed 6 deals, 6 important clients through this process. And again, lessons learned. Here, we understood that the surgeon, we need to understand the right channel when you are talking to surgeons, because you cannot think that you're going to do all your journey with a surgeon only through LinkedIn. You can start contacting them by LinkedIn. That's very appropriate, because from our tests and our data, we see that the surgeons, they answer a lot on LinkedIn. You can start there, but then you have to have a very follow through other channels to be able to do a proper outreach to a surgeon. As we just mentioned before, Messaging was extremely important here because you need to do an extensive A/B testing to understand which was the appropriate way to approach the surgeon. And one interesting thing here is about the content boost or the display ads that I just mentioned, because the content boost, when you boost a post or you create a display ads, you get, of course, a lot of impressions. But this result is useful for brand awareness, but brand awareness is very intangible. So if you're trying to do a paid activity, if you're trying to include content boost or display ads within your omnichannel approach, it has to be on the context also of outreach and other activities, because otherwise you will not be able to really harvest the results or have any idea of if your content really, if your paid activity got any real results. You're going to see many impressions, but no meat, let's say, around the bone. Any comments here, Elvio, Marco?
Well, first of all, again thank you. The first comment that comes to my mind, that was a second question, but I think you explained it very well. So I'll make it a comment. What I really liked, especially when you explained the A/B testing approach, the idea of refining your message. We were discussing about the target audience, and I think with the two cases we see how the different approach has been. I mean, how this similar strategies have actually had different approaches, and in this case, what particularly resonated is how you understood what was the right message, how you were creating value. So with the message A,